have, physical, cognitive, and emotional, and not everybody's going to have every symptom. Because again, when you've seen one person with brain injury, you've seen one person with brain injury. But these are some of the things. Common is fatigue, headaches, dizziness, difficulty with balance, difficulty with thinking and attention, planning and organization. Very common for folks to develop depression or anxiety after a brain injury. If you think about having to cope with some of these symptoms and navigate life with them, it's very challenging. We see an increased risk of mental health concerns post-injury and an increased risk of substance use post-injury. Some folks, had a predisposition going into the injury, but some folks are also using substances to help medicate the situation, right? So lots of stuff can be happening post-injury to disrupt life. So these are the things that make it challenging for folks to return back to school after an injury, to return back to work after the injury, and to maintain relationships. So these are some of the approaches that we recommend to someone who suffered a brain injury when they are suffering with any one of these challenges. Immediately, I think you're probably going to notice that you encounter daily, even with folks that haven't had a brain injury, people who have some of these challenges, difficulty with memory and impulsivity, and I'm sure you are currently employing these tactics. But these are just a reminder of some of the things that we can ask people to do or do to help them navigate things a little bit better. Making sure that people are taking breaks and encouraging rest in between, making sure to use to-do lists to prompt people to do things, notebooks to keep notes of things, breaking things down into smaller pieces, right? Not overwhelming somebody with a big task, but breaking it down into smaller pieces. It's easier to focus. It's also easier to remember the steps if it's smaller. Making sure we have structure and consistency in our days, making sure to decrease distractions. I know this is of huge concern with many of the people that we work with, but really reducing any audio distractions, any visual distractions, because with anybody that's struggling with processing, any extra inputs is going to make it difficult to focus, right? So just a few tips on how to manage some of that. Any questions about any of that? No? Okay. Do you have to lose consciousness to sustain a brain injury? No, you do not. So that's another big myth out there that they'll say again. Oftentimes in sports, if a kiddo gets hit in the head but they didn't lose consciousness, oh, you're fine. You didn't lose consciousness, go back in. That is not true. Kiddo needs to come out if they're having any symptoms from that. You do not have to sustain consciousness. In fact, only about 10% of concussions actually lose consciousness. About 90% of them, you're not losing consciousness. So it's actually less common than one would think. So a little bit about us and the supports and services we offer. We cover the entire state, cover all 88 counties. All of our programs are free, and we have no parameters for service. So I think that's important because some entities only serve people that have had traumatic injuries, or they only serve people that have had strokes, or whatever the case might be. We serve people regardless of how they obtained their injury, regardless of where they are, and even if they don't have a diagnosis. We get a lot of phone calls from folks that are, hey, I think I may have had an injury. What do I do? How do I get a diagnosis? We have no parameters for service in that respect. And everything that we provide to a caregiver or survivor is free and no cost. We don't ever charge for services. We recently had a woman contact us who was watching a hockey game. And somebody got checked on the ice, knocked in the head, and they started talking about concussions. And the woman reached out to us and said she had never thought of it before, but she had actually endured years of domestic violence. And that now she put two and two together after listening to the hockey game talk about concussion, that perhaps she had sustained a concussion. And the reality is she probably sustained several concussions from her experience. But we were able to connect her to a medical provider to get evaluation and assistance in coping with those symptoms. And we're talking 15 years out from when she was experiencing this. So like I said, we don't ever require a diagnosis or any of that to help people. We do say Ohio, obviously, but we do get calls from other states because not every state has an association, so we don't even put a geographic limitation on it. This is just a high-level overview of our programs and services. By far, the most commonly used service is our helpline, and I'll talk a little bit more about that in a second. We do education, so education such as community education like this, we'll come out and do in-services. We do monthly webinars. We have an annual conference, lots of education out there. We do offer support groups and advocacy, and I'll talk a little bit more about each of those things. So our helpline, I like to tell people, is really, you'd be shocked the number of calls or the percentage of calls we take that have very little to do with the actual injury, right? So we do take calls, obviously, for find me the local doctor that can help with this, find me the nearest physical therapist that can help with this. But a lot of what we work with actually, again, has little to do with that medical diagnosis and more to do with the ripple effect that brain injury has, right? So you'll see in the state map there, we took all of the call topics we had over a period of time and put them up there. We're more often helping people find housing, return to employment, return to school, helping with home modifications, helping them apply for waivers, helping them get an income, all of that type of stuff, right? Because again, when somebody suffers a moderate to severe brain injury that disrupts their entire life, oftentimes these other things are greatly impacted. So we have folks that are in an inpatient rehab and were evicted, right? Because they were in the hospital and rehab for 3 months or longer, and they've been evicted from their home, or they've lost their job because they can't go back to it. So those are the types of things that we're helping with folks with. We offer 3 levels of support through our helpline, and our helpline is a phone number, a website, and an email that people can reach out to. The base level of support, again, is that person that's calling and saying, hey, who's a physical therapist in the area that helps with brain injury, or who's a physician that helps? And you'd be shocked to find out that people that understand brain injury and specialize in it are pretty few and far between. And so we try to curate a list of providers that really do understand brain injury and understand the accommodations that need to be made in their practice to take care of somebody with a brain injury. One of the challenges we see there is that brain injury is actually not taught and tested on the standard medical boards. So unless you specialize or seek out additional education, it's not something that's commonly taught. So that's why we struggle to have a lot of really good providers. I was recently at the Metro Hospitals Rehab, and they offer a fellowship there because I actually had a conversation with them and said, what are you doing to attract people to the world of brain injury to help provide clinical care? And they offer a fellowship, but they said that there's actually 26 fellowships across the country. And some years there's not even 12 matches because there's that few people interested in going into this space. So we're really struggling to have a good base pool of providers. We also take resource requests. So this is, I'm struggling with a specific concern and I need a specific resource. So whether it's, maybe some vision therapy or it's, some driving therapy type situation. So those resource requests would be that next level. And our highest level of service is our neuro resource facilitation. And this is really where we are having an ongoing relationship with this person and following up with them at least monthly to check in and see how they're doing. So if their needs rise to the level of the neuro resource facilitation, at the start, we're creating a plan with them. What are your goals? What do you hope to achieve? And then we take them piece by piece and work with them on those goals throughout a period of 1 year to 2 years. And this program was born out of the beginning of our helpline, but also our backpack program, which I'll talk a little bit about here in a second. So these are all the ways to contact our helpline. We have a toll-free number, again, an email and a website that anybody can reach out to. So we not only talk to caregivers and survivors, but we also consult on difficult cases with professionals as well. So that's our information. And then I spoke a little bit about education. We have our annual summit. So this is a 2-day conference we do. It's hybrid, located physically in Columbus and then virtual as well. We offer CEs for all different kinds of disciplines. And we bring in national speakers on brain injury. That will be in the October-November timeframe this year. And then we offer monthly webinars, and those are free to attend. Those are virtual. And then if you are a member of the association, you can access them, all the old ones, for free. And you, as a caregiver or survivor, you can always join our association for free. So that's available to them as well. And the topics for the webinars range everywhere from returning back to school to intimacy after brain injury to how to apply for Social Security disability after a brain injury. There's just a huge range of topics out there. And these are 2 of our upcoming webinars. So we've got Dementia Friends with the Brain Injury Association. So that, you know, we talk about the kind of the possibility of developing a dementia post-brain injury. And then we have somebody coming from OOD as well to talk about vocational rehab after injury. So as I mentioned, we do have support groups. These are volunteer-led groups throughout the state. Some are in person, some are virtual. And some of them are specific to spouses or young adults or whatever the case might be. We are always looking for more support group facilitators. We actually used to have a group in Medina, and we no longer have a group in Medina. So always looking for folks that are willing to partner with us in creating that. We definitely know that there is a need for folks to get that support. Another service that we offer is our Healthy Minds program. So this is a program that's virtual, offered to both caregivers and survivors, free to attend. And every week we go through a different element of wellness. So we do yoga, adapted yoga, we do meditation and mindfulness, nutrition, and we do creative expression. So anybody that participates gets a box of supplies delivered to them at the beginning of the quarter, because we run it for 3-month periods. And it's everything that they need to participate in that program for the quarter. And it's not only focused on wellness and setting wellness goals for yourself, but it also acts as kind of a support group as well, because folks start developing relationships and talking to each other about the goals that they've set and where they're at and helping each other problem solve. So it's a really neat program. We've had such success with this that we've expanded it to 2 other forms in the past year. One is Healthy Minds for inpatient facilities. So we're actually bringing it to folks that are still in inpatient care getting help. And then also we've expanded it to Healthy Minds on the Go, where we do kind of pop-up events throughout the state. We're currently working on an event in Stark County at Pegasus Farms. And then we've had yoga down in Mason and an art project down in Columbus. And so we try to kind of get people together in person when we can as well. So I mentioned our backpack program. This was where that neuro resource facilitation, the formality of the program came from. So we were hearing from families that when they were going home, they had an injury, they were in a hospital or an inpatient rehab, and they were going home, that either they got nothing, so they just went home with nothing, or they were sent home with 3 binders worth of every piece of information on brain injury ever known to man. And both are equally unhelpful because those 3 binders, right? Nobody is going to take the time when you're in the middle of transitioning back to home and community living to read all of that. So we developed this program so that we could try to make it a more person-centered approach. So we provide these bags to inpatient facilities, and in it are just, you see some of these things, just helpful tools to help cope with some of the symptoms after brain injury. But what we see is the most important thing is the release of information so that we can contact them. So what happens then is 2 weeks post-discharge, we call them and say, hey, how's it going? What are your concerns today? And what are our goals? Are we hoping to get back to school, get back to work? Are we hoping to re-engage in our rec and leisure activities? What are we hoping to do? And then we create a personalized plan of how we're going to get there and give them resources specific to whatever their goals and needs are. So rather than every piece of information about brain injury ever known to man, we're giving you just what you need to help you reach your goal. So that's just a tool that we currently use to help people, number one, get connected to services, because we were hearing from people that on average it was taking them 2 years to find us. And number two, try to tailor the information that they're receiving to what they actually need. So the question was, how long have we been around? We've been around for over 40 years. Yeah. So some people it takes 40 years to hear about us. So yeah, and that's a big part of why we try to do community education now. Like, we've really ramped that up in the last few years. I came on board about 2.5 years ago, and really tried to ramp up community education so that people are aware of us. So yeah, so you're not alone, unfortunately. We recently started our podcast club. So the podcast club is really kind of an adapted book club, right? So some of our folks after injury struggle with reading or comprehension and retention. So what we did is we created this podcast club where we send folks a link to 1 or 2 podcasts related to a topic on brain injury healing and wellness. So whether it's resiliency or managing big emotions or whatever the topic of the month might be, we send them those couple links so they can listen at their leisure and then come together in a group and talk about it. And how has this impacted their healing journey? How might they use these tips and tricks, and that sort of thing. So this is recently launched the last month or so, and is starting to get going. And I think people are really enjoying the opportunity to kind of extend that support group feel. So this is something we're really excited about. A new program that's launching this summer. It's called our Neuro Sparks Retreat. It'll be the first week of August. We're doing it in partnership with Cleveland State. And we are looking for survivors that are 2 to 3 years out from injury. Folks that we would expect have plateaued in their rehab, probably are not qualifying for any additional therapies right now, and would benefit from a little boost. So what this is we partner with Cleveland State's different colleges. We've got PT, OT, speech, nursing, family nurse practitioner, and there's one other discipline that I forget who it is, but we have the students come in and they do a complete evaluation of the individual and then create a plan for them of what they should start incorporating at home to progress their rehab. So they go home with a homegoing plan, and then everybody gets an Amazon Fire tablet preloaded with any apps that the therapist recommends specific to them. It's a 3-day intensive program. The caregivers get caregiver education in how to help their individual and support them. So we are hoping that we will be able to take in 10 to 15 people here in August and trial it and then expand it across the state. We do advocacy as well. So you see us here at the Ohio State House talking about the importance of funding brain injury services. So we did a peer review of all of our contiguous states last year and found that Pennsylvania invests in brain injury services about $22 per resident. West Virginia, Kentucky, and Indiana all sit very close to $1 per person per resident in brain injury services funding. How much do you think Ohio invests in brain injury services? Just make a guess. 50 cents is too high. 10 cents is too high. That's a little too low. 5 cents. 5 cents. 5 cents per resident. Yeah. So we can do much better and should do much better for our brain injury survivors, right? So that's what we do in our advocacy work, is really try to talk to legislators about how sad this is and how we need to do better for our folks, for sure. 22. So we only looked at our contiguous states. So, you know, the feedback I got from the people in the political world, because that is not what I exist to do. The feedback that we got was that what they are most concerned about is what our peer states are doing, right? So these aren't even necessarily states that we would aspire to be, not that they're bad states or that they're not doing good work, but these are not even like the gold standard of brain injury care states that you would hope to be like, right? There's really great things happening in Texas and Virginia and, you know, other states, Colorado, that have bigger, more robust service systems. But this was just local to us. So you would expect us to be in line with them because we're all similar size, demographic, wealth, and we're clearly not anywhere. Yeah, so, yeah. So we do have events throughout the year to support our services and also to bring caregivers and survivors together as well. We have a Christmas in July event coming up in July in Kent, where Santa will come and decorate cookies with us. We hand out free bike helmets to kiddos and a lot of the things that we do, but specifically we'll do that at that because it's a very kid-focused event. We do crafts, we visit with goats and alpacas. It's a lot of fun, and it's only $30 per carload, so we don't care how many people you shove in your car safely to get through the gate. So it's a nice deal. And then we have our 5K walk, roll, run, and we do that kind of throughout the state because, again, we serve the whole state. So there will be a location both in Strongsville and in Fair Lawn, close to here. So those events will be coming up. And how can you join in the mission? We are always looking for volunteers, whether it's helping with events or programs or being a support group facilitator. You can always become a member, and then obviously anyone can donate to us as well. And that's how you can get in contact with us. So I would love to entertain any questions. Oh, it's easy peasy. To be a support group facilitator, we just meet with interested individuals to talk about, you know, do you have a space identified? Do you need help identifying a space? We help identify spaces. We usually recommend that there be co-facilitators because we don't want any one person to bear the full responsibility and get burnt out. So we try to pair, you know, if you're interested, finding somebody else that's interested in connecting the two of you, do a little bit of matchmaking. And then we offer training. So we provide training on how to facilitate the group, how to promote the group, how to start it and launch it. And then we offer our support group facilitators training and education every other month. Virtually, we bring all the facilitators together and we talk about, you know, if you have a difficult case come to your group or a difficult person come to your group, how do you handle that? How would we recommend you handle that? And then we offer speakers that you can bring into your group, topics to talk about, and try to support as much as possible, you know, you in that role. So good question though. Well, so the question was why is there not a, I'm sorry, I'm repeating for online. Why is there not a lot of interest in brain injury? So I can't say that I'm the expert in that answer, but what I can tell you is that I did talk to some other physicians that are in brain injury about why would this be, what makes it unattractive. And it is a very demanding specialty. So typically, you know, you are working with an inpatient type facility and you are doing on-call periods of time in either an ICU or an inpatient rehab, or you're connected in some way to that. Whereas, you know, as it was described to me, how often is there a plastic surgery emergency, right? Like if you go into plastics, that's an easier gig, and similar or better money. You know, also you think about some of the other specialties that don't necessarily have, you know, you're not running to have a podiatry emergency on, you know, Saturday at 10 o'clock, you know, that sort of thing. So that's the explanation I was given. And it's a hard gig to do for sure. And I'm not positive that there's really any more reward to doing that other than working with a population that you have a passion for, would be my answer. Any other questions? Where are you guys out of? Sure. So we're remote. So we are all spread throughout the state. I have somebody in Columbus, somebody in the Cleveland area. I have somebody in the Akron area, up towards Toledo. I actually just recently moved to Medina County, so I'm right down the street. Yeah. No, my degree's in psychology, and I have spent 25 years in aging and disability services. So worked in nursing facilities, home care, worked at, ran a couple DD day centers. So I've just kind of walked across the continuum and ended up here. When this position actually came open, I was looking for a change. And again, it kind of fits with what I've been doing for most of my career. And I actually have a family member that has sustained 2 traumatic brain injuries. And we were the people that went to the emergency room. The first one was a motor vehicle accident. And we went to the emergency room and they bandaged her scrapes and cuts from the road rash and said, "You're good to go." Never scanned her head. So I was the family member that was like, "No, this isn't right. We've got to go seek out help." And so I took her for follow-up and we got therapies and all that. Second traumatic brain injury was a fall. So we're covering the top 2 in our family. And very similar. Bandaged her leg up. She had broken her leg, so casted it, sent her on her merry way. And it was her second brain injury within a short period of time. And so it had a very significant impact on her cognition. Like, it was a big change. Much more loss of independence, much more challenging to recover from, but again, was not evaluated for a brain injury in the ER. So we had to take her to get that follow-up, and we did, and she did therapies and has done very well post-injury. But that's why I really hover on that. Just because you go to an emergency room and they say you don't have a bleed or a fracture doesn't mean you don't have a problem. And to definitely seek additional care if necessary. And then unfortunately, my husband had a stroke last summer, so we're covering all the brain injury basics. So for me, this was kind of bringing together a personal passion with where my career has been. So, yeah.
You can talk about your work with the VD population,
Mm-hmm.
And that's and I have a couple on my caseload. How do you work with, because they don't need the I guess the physical, it's more of the mental, the impulsivities, these kinds of things. What is offered for that?
So when you're dealing with the cognition piece of it, so some of it is therapy. So sometimes, depending on what the issue is, it could be working with speech or occupational therapy on some of that. But also, we often will recommend folks that are really struggling to have a neuropsychological evaluation and see if they can get some neuropsych rehab, because that depending on the individual and depending on what the concerns are, that can be an opportunity to work on, reducing impulsivity and improving attention and doing those sorts of things.
Yeah, I guess I've had a couple that have had years. I mean, there have been years with the TBI, and that impulsivity, and I'm the behavior specialist, so that's what I'm trying to work with.
And unfortunately, those neuropsychs are part of the few and far in between, right? There are some good ones in the area, and it depends on the individual as to how beneficial that rehab is going to be, but they can at least have an evaluation and determine if that rehab can be of benefit. Mm-hmm. Absolutely.
How often do you get calls from schools for sport?
How often do we get schools calling about sports? Not often. Right. So we, So, the sports world doesn't like to hang out with us, which is really unfortunate because our message is not that all sports are bad or that you shouldn't do sports or that none of that. My own daughter is in like every sport known to man. Like I support it 100%. Our message is to do it as safely as you can do it, right? And if an injury occurs, because injuries are going to occur, and we're never going to eliminate brain injuries entirely, because even if we got rid of every sport and we got rid of all the cars and we got, we got all of these other things, I could walk through here and trip and crack my head open right there. Like you can never completely eliminate them. So when an injury occurs, we just want to make sure that it's addressed and treated, right? Pull the kid and have them evaluated. Let them go to therapy and rehab before you put them back into the sport. Making sure that people have appropriate accommodations when returning to school and that the school is sensitive to what having a brain injury is going to do to that kid's return to academics. So we definitely don't advocate not being active or not doing sports, but to do it smartly, wear a helmet, right? Don't put younger kids in situations that they don't need to be in that put them in danger. Those types of things. But we advocate staying active but safely.
That's a passion of mine, just to work with disabilities, nursing homes with, clients there that are there with dementia.
Mhm.
And my son also, he has epilepsy.
Mhm.
And just if I would have known, some of this information when my son was younger, I might have said that, but that would have been us bullying him,
Right,
and that was taboo.
right.
So for me, I'm just interested in getting that information up to parents now, when their kids are going through something.
Absolutely, 100%. So I coached CYO volleyball a couple seasons ago, and to become a coach, I had to sit through no concussion training. I did have to sign a piece of paper that I had read, like Lindsay's Law, and that I understood, that if a kid gets hurt, that I got to pull them. But a piece of paper that I signed that I read it, and that was it. There was no training. Now I had to sit through, a full day of how to teach how to set and how to teach how to bump and how to motivate kids that weren't motivated, and which is all important, right, with coaching. But I would have liked to have seen even 20 minutes of that day devoted to how to even identify that a kid potentially had a concussion. Because I saw in my own coaching experience, kids get hit in the head and sent back in. Like it happens, it's real. And I think getting the information to parents is tricky because it's finding an advocate or a champion within that school or that athletic association that's willing to even have a conversation about this is a thing. It's definitely something that we're working on. We have the plan to get out there and try to do that, but it's also trying to go kind of area to area and find a champion that's interested in having that conversation. For sure. Yes.
And football, both, like parents need to know that they can purchase. We bought like very expensive helmets,
Mhm.
To prevent concussions and that. Parents aren't aware of it. Sometimes parents don't want to pay money.
Well, and sometimes they don't have the money.
Right.
Yeah, that's an issue too. And there are football helmets out there that will reduce the potential impact, but not
Stop.
right, but will not eliminate a concussion, but reduce the potential impact. But it's, is that readily accessible to everybody? Not
And at the
necessarily.
high school, they did make, all the kids had to take a test for baseball. So then the trainer would check them. So they were pretty good about it during my school.
That's good. That's good. And
Both of them had good questions.
okay.
But it was good because they did do a baseline and not let them play until.
Right, right. And that's great. And I will say I see varying levels of adherence to that, depending on where in the state you are, and it's not across the board. Yeah, for sure. But I mean, that's so much of what we live with, right? Is not every city does it a little bit differently, or every school district does it a little bit differently. Sure. Any other questions?
Do you have, I guess, training for caregivers on how to handle emotions that may come?
Yes, we do have.
With, with dealing with somebody that has an injury.
Yes.
And, a lot of emotions, like being angry,
Mm-hmm.
and just how it does.
Absolutely, absolutely. So we have I want to say that we have some on our website. If we don't have them on our website, we also have resources that our helpline has that we send to people, specifically dealing with helping people manage big emotions and how to react when folks have outbursts of anger or irritability, because we definitely do see some of that post-injury. And then we can also provide that as a training as well. Anything else?
So if we go on your website, you can find all this.
Yes, everything that I showed today, you should be able to access, and then there's resources and tip sheets and fact sheets about different things. So for instance, that one slide that I had that said how to support somebody with brain injury, and it talked about attention and memory and all of that, we have a full 2-page handout that lists many more symptoms and ways to support an individual. We just selected a few that we thought would be appropriate for today. So you'll find that on there. And then anything that you are looking for that you don't see, if you just email that email, we can send to you, because we have many more resources as well. So that's not a problem at all. All right. Well, thank you so much. Have a great afternoon and enjoy this beautiful weather before the rain comes this way.
Thank you for attending our training today. We'd like to thank Lauren Holly, the Executive Director of the Brain Injury Association of Ohio, for presenting. Our next presentation will be Independent Provider Meet and Greet on Wednesday, May 15th, 10 a.m. to 11 a.m. here at the Medina County Board of Developmental Disability Achievement Center. Have a good day.